According to the National Alliance on Mental Illness, consumers frequently experience situations in which they are given little control over important treatment decisions. Families just as frequently are frustrated by having to stand by and watch their loved ones deteriorate and suffer. Psychiatric Advance Directives, or PADs, have recently emerged as potentially helpful tools in resolving these problems by outlining consumer preferences for future care. In this presentation, we will discuss how these laws can be helpful to consumers, families, and clinicians. Not all states have separate Psychiatric Advance Directives laws, so it's important to understand the law in your state. To learn more about your state, you can go to the National Resource Center on Psychiatric Advance Directives website and look up your state.
I don't want Cerebritol because one time I had it and I got pancreatitis. I do not wish to go back to that hospital. I was thrown in a dark room and was scared and got hurt by another patient last time.
It would be helpful to know that the right people would be notified if I were in crisis. I only wish I could do something. I know he wouldn't want this.
A Psychiatric Advance Directive, or PAD, can help those at risk for a mental health crisis to solve many of these problems in advance. A PAD is a legal document that states the consumer's preferences about his or her mental health treatment, anticipating that the consumer may not be able to state those preferences in the future exactly when care is needed. The information in PADs helps the consumer, their families, and their treatment providers in pursuing the consumer's preferred care.
The information in PADs describes crisis symptoms, states medication and hospital choices, lists emergency contacts, documents relapse and protective factors, and relates instructions to staff and others. This information has several uses.
An important use of this information is to empower the consumer to direct treatment decisions during a crisis. PADs can also be very useful in enhancing communications about treatment preferences among the consumer, their caring family, and treatment providers. PADs may facilitate appropriate and timely treatment interventions before situations deteriorate to emergency situations. Finally, PADs may lead to reductions in adversarial court proceedings over involuntary psychiatric treatment. A familiar treatment provider can help a consumer create a Psychiatric Advance Directive by explaining options and offering valuable insights and guidance. Let's look at an example of this facilitation process as Dr. Thompson helps Carolyn complete the required forms.
Carolyn, today we're going to help you decide if you want to fill out Psychiatric Advance Directives. If you do, I'll help you fill them out.
All right. Thank you, Dr. Thompson.
Okay, great. Under state law, there are two kinds of Psychiatric Advance Directives you can fill out. First, you can write what's called an advance instruction, where you say what kind of treatment you'd want to have if you had a mental health crisis. So you can write what kind of medications you'd want and what kind of medications you wouldn't want, what hospital you'd want to go to and what hospital you wouldn't want to go to. You can include mental health and physical health information you think it would be important for doctors to know. Now, before we go on, I want to make sure I'm explaining this clearly. So tell me in your own words what this advance instruction is.
Well, it's a legal piece of paper that will help me when I get ill.
How?
Well, when I get ill, I have trouble thinking clearly, and so sometimes I might want to tell the doctor something, but can't. This instruction document will help do that.
Yes, exactly. That's what the advance instruction will do. Does that sound like something you'd be interested in filling out?
Yeah, that would be good. Is this only for when I get mentally ill or physically ill too?
This is meant for when you can't make decisions in a clear way. While that could happen for a number of reasons, the advance instruction we're going to fill out mainly has to do with your mental health treatment. Now, you can tell doctors things about your physical health, of course, but the instructions are mainly for mental health.
Okay, I get it.
Don't hesitate to ask questions. This is not easy to understand, and I want to make sure at all times that you're on board with what we're doing, okay?
Yeah.
Okay, before we fill out the advance instruction, I want to tell you about the second kind of Psychiatric Advance Directive you can write. This one is called a Healthcare Power of Attorney, where you choose someone you trust to tell doctors the kind of treatment you'd want to have if you had a mental health crisis. So this person, called a healthcare agent, would tell the doctors what kind of medications you'd want and what kind of medications you wouldn't want, what hospital you'd want to go to and what hospital you wouldn't want to go to, and give doctors mental health and physical health information you think it would be important for doctors to know. Before we go on, I want to make sure I'm explaining this clearly. Tell me in your own words what the healthcare power of attorney is.
You mean I can have my therapist do this?
No. The law says that healthcare providers can't be in the role of healthcare agent.
Would it be okay to have my mom be the healthcare agent?
Yes, but tell me in your own words how you understand this. I want to make sure.
Okay. My mom would tell doctors what kind of things I want when I get mentally ill.
What kinds of things?
I mean, treatment decisions.
And is your mom someone you can trust to do this?
Yeah, she knows my mental illness pretty well. She'd do a good job. Plus, she's my mom, always looking out for me.
Just so you know, healthcare agents are supposed to tell doctors what you'd want, not what the healthcare agents want.
They're like my spokesman. I want my mom to do that.
That's exactly right. Nice. Okay, let's get going. Let's start with the advance instruction. The first thing you may want to write is the kind of symptoms you have when you get into a crisis. This would include mental or physical signs indicating your mental health is getting worse. Listing these symptoms could help treatment providers recognize early warning signs you may be experiencing problems. Tell me what you look like when you get sick.
I can't think straight, you know?
Tell me more about that.
Well, I believe that everyone is speaking badly about me, and then I have voices telling me the same thing.
What do the voices say?
They're like, Carolyn, you're no good, and go kill yourself, and other negative stuff.
Now, you can write these down if you want. It's up to you.
Yes, I definitely want them in the instructions. Doctors need to know I get suicidal.
Okay, good. What else would you want them to know about when you get sick?
I stop eating, and I'm sleeping a lot. I get very depressed.
That's a lot of good information. Thanks. Anything else you want to include?
No, that's pretty good.
All right. Next, you can describe what medications you'd want. It's important that you know that doctors don't have to listen to these if they think it's not good treatment in that particular situation.
Really? Does that mean they don't have to listen to the instructions?
No, just because they think one instruction is not good for you, they cannot just ignore the rest of the instructions. One thing that's helpful is explaining your reasons for your instructions, like the effectiveness of medications or strong side effects. Doctors are more likely to understand where you're coming from if you do that.
Yeah, okay.
Okay. If you were in a crisis, would there be medications you'd want to make sure you got?
Yeah. The Caldane is really helpful for keeping down the voices. I want that. And the Ziprol helps me not get suicidal.
Excellent. That's very helpful. Are there any others you'd want?
Well, not that I'm on now. Maybe in the future I'd be on some I don't know right now.
Oh, you bring up something important. Because we don't know when this advanced instruction will be used, hopefully almost never, you're right that you may not be on Caldane or Ziprol then. You may be on better, new drugs. What you can do is write down that someone should speak with your outpatient psychiatrist to find out what you're on and what's helping. Does that seem like a good option?
So I write down Caldane and Ziprol, why they're good, and also to talk to my doctor about what is helping now. I mean if I get sick.
Exactly.
Yeah, let's write that in.
Okay, next. Are there any medications you do not want to receive in a crisis?
Yes.
Okay, which ones and why?
Well, I absolutely never want to be given Cerebritol again. It turned me into a zombie, and I think made me worse. I don't want penicillin. I'm allergic. Does that go here?
There's a section for allergies. We'll put it there. Any other psychiatric medications you wouldn't want?
They did try me on Sumanak for almost 10 years, and it wasn't bad, but I wouldn't want it again since Ziprol has worked better.
Okay.
That's really it.
No problem. We're moving right along. Okay, next, you can write down what hospital you'd want to go to in the future.
Definitely the University Hospital. I really got better there last time.
Okay. It's important to realize here that it may not always be possible to go to the hospital you prefer.
I figured that. So you're saying that I can get what I want as long as it's a real option?
Kind of. What I'm saying is that if there's not a bed available or your insurance doesn't cover it, it may be hard to follow the instructions.
Makes sense.
Now, what hospital would you not want to go to?
The state hospital.
Tell me about that.
The last time I was there, my roommate attacked me, and I'm not the kind of person who looks for trouble. If I can go somewhere else, that would be much better, you know?
All right. Any other things you want to write?
No, that's good.
Next, you can list the names, addresses, and phone numbers of people you would want contacted in an emergency. You can also include information about your physician, psychiatrist, or case manager therapist.
Okay, let's write down my mother's info, my psychiatrist's info, and my family doctor's info. How's that?
That's great.
I don't know my doctor's phone number. Let's see.
No problem. Let's look it up together in the phone book.
All right. Yeah, there she is. I should probably write it down for myself in my wallet, you know?
Having your doctor's phone number in your wallet is not a bad idea. Also, you'll have a copy of your advance instructions so you can look up your doctor's number there, too.
Oh, okay.
Great. Let's go on. It may be helpful to write down the sorts of things that cause you to experience a mental health crisis. If you can't think of anything, you can list certain situations that are particularly stressful to you.
That's easy. Getting behind on my bills, staying at home and not going out with my friends. Oh, and if I don't take my meds, I get sick.
Anything else?
Nope, that's it.
Okay. It may also be helpful to list things that can help you stay well. What do you do to stay out of the hospital?
I go to church every Sunday. I read a lot of science fiction. I love Isaac Asimov and the robots. I take my meds every day. I work a bit at the grocery store. I go to the movies with my friends. Is that good?
That's great. And great ways to stay well. That's your secret. Next, it might be helpful to let the hospital or crisis unit know what they may do to help you in a crisis. Anything come to mind?
Well, one time I really was feeling suicidal and needed to talk to someone, but things were chaotic on the unit, and I couldn't. I wish staff would know that sometimes I need to just talk. I know it's busy and all, but if they knew, maybe they'd make an effort, you know?
It sounds like a perfectly appropriate thing to write in. Anything else?
No, that's fine.
Okay. It might be helpful to provide instructions for staff for what to do if you are feeling out of control.
Yeah, I don't want to ever go into restraints again.
Anything staff could do next time to avoid that?
I think that if they gave me some time to talk and then maybe some time to read, that would help me chill out. I don't know.
Well, that's pretty good. Whatever you think is what we write down.
Okay.
Okay. Next, you can write down what you want to do about ECT. Do you know what ECT is?
Shock treatment.
Yeah, ECT stands for electroconvulsive therapy, which is sometimes used in severe episodes of mental illness, primarily depression, usually after multiple trials of medications have failed. Now, ECT could be used earlier when a rapid response is urgently needed or the patient requests.
Oh.
So here you can write whether you want or don't want ECT. If you don't know either way, you can write that you want your doctor to advise your health care agent so he or she can decide.
I don't want anyone messing with my head.
What about as a last resort, meaning you might not get better without it?
Well, put that way, I'd want it, but only if it was a last resort and they've tried everything and that's the only way to help me get better.
What about writing that down?
Yeah, let's do that.
Lastly, you can list any other instructions you want. Some examples are writing instructions about paying rent or feeding pets while you're in the hospital, and listing any other medical conditions you want doctors to be aware of.
Well, I want to make sure my mother pays my rent.
Okay.
Doctors should know I have diabetes, and sometimes that looks like depression, but isn't.
Good. That's really important information.
And I don't have any pets, but I do have plants. I suppose my mom can water those.
All right.
But that's about it.
Great. And now let's fill out the healthcare power of attorney forms and set it up for your mother.
Will she get a copy of these 2 legal papers?
We will send copies to whoever you want.
To my doctor?
If you want.
Yeah, she should know about this.
Anyone else?
No, that's all.
Great. Well, now that we've finished these, all we have to do now is get these notarized.
Great. Thanks for doing this. Now I feel like there's a plan if I get sick.
That's the idea. But it's you who really did the work here. These are your instructions, so congratulations on your good work.
Thanks.
Do you or someone you know need the benefit of a Psychiatric Advance Directive? Visit the National Resource Center for Psychiatric Advance Directives website and obtain specific information for your state. While you're there, subscribe to our newsletter for continued updates on PADs.